diabetes and kidney disease. This is a little picture of the kidneys. So as you know, they look like little beans or big beans. This is a whole one, and this is a cross section of the kidney, and there's lots of blood vessels in there. So what is the job of the kidneys? Kidneys has some work to do. We're not going to talk about everything. We're going to focus on one main function, but some of the things that the kidneys do. So the kidneys filter out waste products, and there's tiny little blood vessels in the kidneys that do that. As you can see, there's this big blood vessel here. This is the aorta that travels, and then it goes, and then there's all these tiny little blood vessels, and the smallest ones are the capillaries. So lots of blood vessels to do the filtering job. The kidneys also help to control blood pressure, and they make red blood cells. They're part of the system that makes our red blood cells. We're not going to focus on these two things per se today. We're focusing more on the filtering of waste products. That has a lot to do with diabetes. How does diabetes lead to kidney disease or chronic kidney disease? So, like I said, one of the jobs of the kidneys is to filter out waste products. So when we eat protein creates waste products that are filtered through the kidneys. And it goes through, these waste products go through the tiny little blood vessels that I showed you in that previous image. And useful things are removed, that's blood and protein, those are removed. So they stay in the bloodstream, but the things that are filtered out, the waste products, those turn into urine, and that's what we pee out. So with diabetes, as you know, it's insulin resistance, and there can be high blood sugars if the diabetes is uncontrolled. And if it's chronically uncontrolled, so there's high blood sugars circulating around for a long time, then it leads to the kidneys doing a lot of work and filtering more blood, trying to filter out the high blood sugars and filtering more blood. And after a while, it just starts to wear the system down, and it starts to break down. When the filtering system in the kidney starts to break down, protein starts leaking out. And that's not good. That's the first sign of kidney disease. And there's early kidney disease, and then there's later kidney disease, which we're going to get into a little bit later. The initial signs of protein in the urine, it's small little protein molecules. That's called microalbuminuria. And we can see that when we do urine tests, and we also do blood tests to check for protein. And then when the kidney completely stops working, and that's when kidney failure happens, and that's when somebody has to go on dialysis because the filtering system isn't working anymore and the toxins need to get taken out. If they don't, that leads to death. And actually, once somebody winds up on dialysis, the typical life expectancy is about 5 years. Now, that's just the average. Some people live longer than that. Some people live less. This is another picture of the kidneys, and down here, it's just showing that there's more tiny little blood vessels, and all these things work to filter out toxins. What are the stages of chronic kidney disease? So there's stage 1, which is considered normal. Stage 2 is mild, 3 is moderate, and then 4 is severe, 5 is failure. You might be wondering, why is stage 1 on there then? That's just the way it is. So pretty much everybody is in stage 1, and that's just basically normal. That's just the way the guidelines came up with these stages. And the actual guidelines for chronic kidney disease came out in about 2002. Before that, it was just thought that chronic kidney disease was something that happened occasionally, and when it did happen, people would go see the nephrologist. It's after those guidelines came out that changes started happening, and we recognized that chronic kidney disease actually can be managed early on, and that can prevent it going from here down to somewhere like failure. What are the symptoms of chronic kidney disease. What are symptoms of kidney disease? The kidneys work really, really hard to do their job of filtering. So you're not going to notice symptoms per se, really, unless something acutely bad happens. It's usually shows up in the later stages. You can get swelling, you can feel tired, that type of thing. So the symptoms are non-specific. And you might be wondering who gets chronic kidney disease, who can get kidney disease. It's not going to be all diabetics. There's varying factors. Remember, high blood pressure. Also, actually, high blood pressure is a disease of the kidneys. Uncontrolled high blood pressure that's uncontrolled for a long time also can lead to chronic kidney disease. So having high blood pressure can cause it, having diabetes can cause it. A lot of times people have both, double whammy, two things that can lead to chronic kidney disease if these things are uncontrolled. If they're well controlled, then very often we're just monitoring things and things stay stable, which is why it's important to keep the diabetes, blood sugars under control, take medications, do all the lifestyle things. There's genetics also. Sometimes it's just a matter of genes. There's other things that can lead to chronic kidney disease too, other diseases, autoimmune problems that can affect the kidneys, like lupus. There's lupus nephritis specifically. There's mechanical things, so things that obstruct in the urinary system that can lead to chronic kidney disease. A lot of times those can be reversed. Sometimes kidney stones can obstruct and cause problems. That tends to be temporary. The main thing is just managing the chronic conditions. So managing diabetes, keeping blood sugars under control, eating a healthy diet. Those are all things to help prevent the progression of chronic kidney disease. Remember this slide, we're all in some form of chronic kidney disease. Stage 1 is just normal. And aging actually leads to chronic kidney disease too. Just as we get older, kidney function goes down just a little bit. So as we get older, over 65, 70, some people are here, some people remain here, and then some people are down here. Again, we're not doing anything here. Here, we're not doing anything. Here, we're just monitoring. And a lot of people with diabetes and or hypertension end up in stage 3. This is why, if you're wondering, why do I have my blood checked every 6 months? Why are they checking my urine every 6 months? We're doing it for a reason. We're monitoring kidney function, among other things. So now you know a little bit about how diabetes can affect the kidneys, things that lead to chronic kidney disease. And a lot of times people say, well, what can I do? What can I do? People get a little crazy when they hear the term chronic kidney disease. That's something that's being monitored. The only thing that you need to do is manage your chronic condition, live a healthy lifestyle. Toxins can affect the kidneys too. Remember, they're a filtering system. They're filtering out waste products. So if you're taking in things that are not supposed to be in the body, that can cause a problem too over time. So cigarette smoking, that can lead to some chronic kidney disease too. Using street drugs, things like cocaine and stuff, those are toxins. The body considers those toxins, and so those can lead to chronic kidney disease over time in varying stages, depending on the person, depending what else they have going on, what other kind of diseases they have, and lifestyle. You've learned about chronic kidney disease. You've learned about how diabetes is related to kidney disease. You've learned about things that you can do to prevent the progression of chronic kidney disease. And that's just managing whatever chronic disease that you have and living a healthy lifestyle, all the stuff that we already talked about, lots of fruits and vegetables, exercising, lots of water. That's all there is to it.